Colorectal cancer is on the rise. It's the third leading cause of cancer-related deaths among men and the fourth among women in the United States. And if you combine the two, they account for the second leading cause of cancer deaths in the country. Dr. Mark Mattingly from Genesee County joins us here on First at 4 in today's focus to take a closer look at colorectal cancer and who it's impacting the most. Dr. Mattingly, thanks so much for being here.
You're welcome.
We were having some discussion before we went on air about colon cancer, and it is rising, but in a certain age group, correct?
Absolutely, absolutely.
And that age group is the under 50 age group, but colon cancer as a whole, the rates are dropping?
Yes, they are. Just because of increased screening protocols that we have, we're finding cancers earlier, so survival is improved, and we're actually preventing a lot of colon cancer because we're finding polyps and getting the polyps out before they have the chance to become a colon cancer.
And let's talk about this under 50 age group where colon cancer, some alarming numbers there. Colon cancer is rising in this particular age group, not the age group typically that was suggested for screening.
Absolutely.
But the cancers are rising. Any reason why, has science pointed to, or medicine, why this particular cancer is rising so fast in that age group?
We don't really know for sure. There is probably multifactorial, probably some environmental, definitely diet, sedentary lifestyle. I mean, there's several risk factors that increase colon cancer in general, and particularly in this population. There are a lot of things you can do to decrease your risk. Why we've seen this sudden uptick in the last 15 or so years, or even the last 20 years, we don't really know. We know it's happening across the nation, and in Genesee County, we're seeing a particularly high number. Just in the last month and a half, I've operated on 3 people in their 30s with colon and rectal cancer. Just left my office earlier today. I saw someone that had colon cancer at 43. So it's probably about 15, maybe as high as 20% of patients I see with colon rectal cancer are younger than 50. And that is a complete different scenario than what I dealt with when I first started practice 25 years ago.
Yeah. Is there anything people can do, you touched on it a little bit, to reduce their risk? If it's not, I guess, hereditary or something like that, and is there anything you can do to reduce your risk? Is it tied to diet or moving, being active, walking? They say walking's the cure for a lot of things, so walking more?
Absolutely.
Yes.
No, absolutely. There's multiple things you can do to decrease risk. I mean, eating a healthier diet, decrease animal fat intake, increase fiber intake has been shown to be protective. If you're a smoker, stop. If you're not a smoker, don't start. If you drink alcohol excessively, you're at increased risk. If you're overweight or obese, you're not only at an increased risk of developing colon rectal cancer, but you're at an increased risk of dying from it, particularly colon cancer. Just getting regular exercise is protective, and getting regular screening, and most importantly, not ignoring obvious signs and symptoms, which is why we get into trouble with the younger population, because they either, if they have rectal bleeding, which is one of the most common things that we see that lead to an early diagnosis, they just assume it's their hemorrhoids. Youngest person I've ever seen with colon rectal cancer is 18 years old. So there's a wide range. My oldest is 103. Cancer doesn't know age. The important thing is just not to ignore the obvious signs and symptoms, and have it evaluated if you do have obvious signs and symptoms.
And let's talk a little bit very quickly about those signs and symptoms. According to the National Cancer Institute, they've identified, I guess, 4 very early signs that say, hey, you may want to go see a doctor. Can you explain those to us?
I mean, change in bowel habits is always a concern. Rectal bleeding is probably the most universal one. The problem is if you have a right-sided lesion, the blood can be mixed in with the stool and digested before it comes out. So, listen to your mom, look at your poop. If you notice black spots in the stool, if you notice blood in the stool, it really needs to be evaluated. Right-sided lesions can actually lead to anemia. So some of the common symptoms that people will have is just feeling tired. If you feel tired, and there's not a good reason to be tired, see your physician. It's something as easy as a check of a lab test, a hemoglobin check, to make sure that your hemoglobin is still within a normal range and it's not low. Because right-sided lesions, that one of the common ways we find those is with people being anemic. Just if you have a change in bowel habits at all, diarrhea where you haven't had diarrhea, constipation where you haven't had constipation, just any change at all, abdominal pain. I mean, there's a lot of signs. If something just doesn't seem right, talk to someone about it. If you don't feel comfortable with what their ideas of what is going on is, then get a second opinion. But just don't ignore, problems that can, lead to an early diagnosis and an early cure. Being found early, colon cancer is very curable. It's very treatable. Late stages, it's difficult to treat.
Dr. Mark Mattingly from Genesee County, thank you so much for coming in today and sharing with us and giving us this potentially could be for someone life-saving information.
You're welcome.
Thank you.